Celebration time. It don't matter what part of the jewel you come from. You da you and me da me. But guess what? All are we the one. See what I mean? Jump and shout all over the nation. We're breaking out with a new creation.
Dr. Orlando Baptist has been operating his veterinary clinic in Roaring Creek Village for more than a decade. Our Belize Watch team stopped in to speak with Dr. Baptist and his team. We will have that conversation after we hear from our partners. Belize Natural Energy Charitable Trust, the Barry, Shell Belize, and the National Gas Company.
We are the Barry, offering you great products, good service, and of course, the lowest prices in the entire country. Visit us in Belize City, Belmopan, San Ignacio Cayo, Orange and now in San Pedro, La Isla Bonita. The Barry. Get more? Be less.
Shell V-Power with 3 times more cleaning and friction reducing molecules. Go well. Go Shell. Since 2008, the Belize Natural Energy Charitable Trust has created opportunities for Belizeans to develop themselves and their communities. The Trust employs tools that are intuitive, collaborative, and accessible so that every Belizean is empowered to achieve their full potential. Over 200,000 Belizeans have been impacted because of our various initiatives. The Belize Natural Energy Charitable Trust, empowering Belizeans of today to create the Belize of tomorrow.
The National Gas Company Belize Limited project became a reality because Belizeans believed in the project and invested in its development, construction, and implementation. Equity financing for the project featured investments from local enterprises as well as one foreign investor. The public-private partnership structure of the project facilitated government's ownership of a 25% stake at no cost to the taxpayers. Debt financing for the project featured the successful launch of Belize's first ever project bonds, some $30 million financed by a cross-section of institutional investors. Investments came from credit unions, notably St. Francis Xavier Credit Union and Holy Redeemer Credit Union, insurance companies, pension funds, and commercial banks. In addition, the project managed to successfully secure some $12 million in debt financing from the IDB Invest. The IDB's participation in this debt financing is a testament to their belief in the environmental, social, and governance principles taken on by the developers of this project. This project is a testament to the growth and development of Belize's financial system. It shows confidence of Belizean investors to put their money behind homegrown and developed projects that contribute to our national development. I am proud of this project and I'm hopeful that there are many more like it to come.
The National Gas Company of Belize, fueling Belize forward.
It don't matter what part of the jewel you come from.
And we are in the village of Roaring Creek, and we have stopped by the Roaring Creek Veterinary Clinic. Do I have it correct, Dr. Baptist?
That's correct, Dr. Rene. That's very correct.
Dr. Orlando Baptist. Dr. Orlando Baptist is a veterinary officer.
Veterinary surgeon.
Surgeon.
Yes, sir.
It means you cut the dog there, and operate pan there.
All animals.
All animals?
All animals, Mr. Rene.
You don't do the dogs, right?
We do all animals. Snake, all animals.
And these are your 2 assistants here with you?
This is Michelle.
Hi, Michelle. How are you?
I'm good.
She's a vet assistant, studied in Galen.
Well, that's a very good university, Miss Michelle.
And Romelio is the assistant and driver.
Romelio Lemus.
Okay. so these are your two employees
Here at the clinic.
at the clinic. When did you start this clinic, Doc?
15 years ago. So we 15 going on 16 years. So it's been a while.
Been a while, right?
Yes, sir.
All right. No, I see you have customers coming in and out. And look, I just glanced to the door just now, and I can see a gentleman with a dog out there. Is he bringing the dog in, or what?
Yes, definitely. He called in for a checkup, so we're gonna do a general checkup, just normal routine checkup, because the dog is up to date with vaccines and shot. So we're just gonna do deworming, some vitamins, and just heartworm prevention, and just make sure that everything is intact. In our glands, we're gonna empty and do the nails as well.
Well, we want to get to your story, but I'd like to see how you'll handle this dog that's at the door there. And the gentleman, let's get the gentleman to bring in the dog. Steve, what's...
Steve Ball, Mr. Steve Ball.
Steve Ball. Okay, let's ask Steve Ball a bit about his dog. Steve, tell me about your dog. This is your...
Yeah, this is our family pet. She's 6 months old now, fully vaccinated. So just brought her for a general checkup.
Okay. And so you have been attending the doctor clinic for quite some time? Yeah.
So, okay. So she's a mix, right? And for her, she looked pretty okay. I can say that she doesn't seem to be obese or to be too thin or mager, like we would say in a Creole. 16 pounds. So 16 pounds is okay, because whenever she becomes a fully grown adult, probably going to weigh about 20, 25 pounds at most.
Okay.
All right, we're going to put her on the table. Michelle, the assistant, first thing we're going to do is we're going to do a temperature check. Yeah, the normal temperature should be around like 101, 102. If it goes over 103, that's classified as fever. Okay. But it depends, because if it's a hot day and they're running, it could be 103, and that could be, we could call that normal as well. So first thing, temperature check. Mm-hmm.
So you see all types of animals, you said, right? So not only a dog would be attended to here.
Yeah, this is the pet or small animal clinic, but we also do like farm animals and even exotic, and sometimes we do work with the zoo as well. So we do everything. It's mixed, basically mixed practice.
Well, I'm happy that we have the opportunity to experience what's being done here. Live. What's the temperature of the dog? Excuse me?
102.6, that's really normal.
102.6 is normal?
Anything under 103 we could accept.
Okay.
Yes, that's okay.
That's okay. So what will happen now, Doc? Let's see this general checkup. The dog is brought to a clinic for a checkup. Let's see what happens as a dog gets a checkup.
Heart rate. So we call it a TPR, like temperature, pulse, respiration. So we already do the temperature, then we do the heart rate and respiration. So with that, we need a stethoscope, Michelle. Okay. Make sure it's a good stethoscope.
And Michelle is well trained by you, right?
Definitely, yes. She been working, doing internship for the last 6 months, and working now. All right. So she knows the routine. Yeah, normally the respiration should be, the pulse should be between 80 to 120. Like smaller dogs tend to have a higher pulse or heart rate per minute. Respiration would be an average like maybe 20, between 20 and 30. 20 should be, normal. Okay. Yeah. And like I said, the temperature, anything under 103, between 100 and 103 is okay. Yes, sir.
But maybe we could look at the importance of taking care of your animals. Your people. A lot of us have dogs, and we could look at.
That's a good question, because a lot of people really treat their animal as family. Mm-hmm. For example, I had 2 rabbits that came in, and the lady wanted them to get spayed, but she was like really nervous. She was like, "Oh, it's my family. They're like my kids." So we need to really take good care of them for the people. So we help people take care of their animals, because it's very sentimental to them. And even dogs are the same. Dogs and cats alike. So the main thing is for them to be healthy, and then the people are happy.
So what is your assistant doing right now? She's calming the dog down? Is that what she's doing?
Calming the dog down. And then we're gonna listen to the heart and the respiration with a stethoscope. Let me grab a stethoscope, Romel, please. One next one, ready?
Okay, that's see yourself in action. Let's go.
Correct. And then we're just gonna check the gums. The gum should always be pink. If you see like a yellow gum, that's a sign that, of disease or infection. They're not doing good. All right.
Okay, Doc. So you're putting on your stethoscope now and you'll do your checking.
Rise and shine, this is a new day now. Positive along the way. We're moving on, no time to delay. Working hard and trying to survive each day. You must enjoy the fruits of your labor. And share them with your neighbor. Extend a hand, we've got to move on. Today is here, yesterday is gone.
So this is a very young dog, 6 months old. So what we're listening for is the pulse per minute or the heart rate per minute, which she's pretty young, she's normal. Respiration normal, that could tell us, for example, if there's a lung infection, or if even at times too as well, we could tell if there's like heart disease. Animals do suffer from heart disease like humans. So it's very important to listen to the rhythm and if it's regular heartbeat or irregular. But she's healthy, she's regular. And respiration is normal. So from there, we'd go and check the gum. We usually start from the head to the toe. So we check the gums, make sure that they're pink and pretty. Okay. It's pink. This is a healthy dog. We press, it should capillary fill time is between 2 to 3 seconds. That's when the blood comes back. Okay. You could see. Teeth are good. No problem with the teeth. The eyes are okay.
But Doc, what if the gums were a bit pale? What would that indicate?
That indicates that the animal is anemic, meaning that the red blood cell count is usually low. For example, we have an infection known as tick fever, which would cause that. Tick fever cause some ticks. Okay. Then we check the lymph nodes that they're okay, they're not swollen.
What would that indicate if the lymph nodes are swollen?
An infection as well. Okay. It could be an ear infection, it could be a tooth decay or tooth infection as well. That may cause that in the head area. So everything's pretty normal. Like I said, she's young. And then we normally do the nails, well afterwards. So we check the back, shoulder, the back, the tummy.
What would you feel for in the tummy? Fed or what are you looking for when you feel the tummy?
What we look for the tummy, we for example, some animal would come in and they're not eating, and one of the first things would be an obstruction. Obstruction could be from maybe eating too much bones, or any, we call it a foreign body. For example, I had a dog came in a couple months ago, and the owner said, this dog eats the very best food. So, better than some people, she said. So, the first thing we did a checkup, we went to check the belly, and when we went the stomach, and by palpating, we felt was full of rocks, those little pebble stones. So, she had to go into emergency surgery.
Emergency surgery would be just like if you do a surgery at a hospital, cut the dog, and take out
so
the
we had to go in, we do a laparotomy, we open up the abdomen. We went to the stomach and we had to take out 2 pounds of stone.
2 pounds of stone inside the dog?
Yeah. So animals do, animals sometimes they just do it because of, they just obsessive compulsive disorder. They just do things like that. And, they do get sick just like humans, referring to like other disease infections.
So those would be like, in the case of human beings, like gallstones or something like that?
Okay, that's a good one. Yeah, because they come in urinary tract infection, they're peeing blood. So one of the first signs we do palpation, we will do blood work as well. But the main thing is a good physical exam. You get a lot from there and talking to the owner. 70% of the information that we need, we get from the owner. The next 30% we do by doing blood work or lab work. Okay. Whatever else needs to be done.
So you do regular blood tests, like taking a blood sample and do a blood.
Urine sample, fecal sample, yeah. The full works.
Interesting.
Yes, we do all of those stuff. So we get a lot of information from the complementary, which would be like the blood work and other urine sample, fecal sample, And even sometimes we do they have tumor sometimes you might have to do, send it off to the lab and see what type of tumor as well.
Very friendly dog, eh?
She's very cooperative.
Yeah.
It's pretty good. It's pretty good dog. Bella.
Well,
Her name is Bella.
Bella.
So the ears are okay. Need a little cleaning, but not too bad. All right. So Bella is good to go.
Bella is good to go. So
Yes, and all vaccines are up to date. Oh, we're gonna deworm. We could do the liquid and then we do the heartworm injectable, 0.2 ml.
What you'll do, Bella, now?
We're gonna just do a deworming, which is for regular internal parasites, and we're gonna do the heartworm shot as well.
Okay.
Injectable we're gonna do today.
Now, the deworming, how quickly does that take an effect?
It works pretty quick. If they have worms, they're gonna pass worms within an hour, a couple of hours, basically. But animals need to be dewormed, especially for heartworm. Like if you live in swampy area, a lot of mosquito, Belize City, every month for heartworm.
Okay.
Once a month, the heartworm, either the pill or the injection.
Once a month.
Once a month.
Okay.
That's the recommended, the ideal.
And a visit like this one that Bella is undergoing right now would cost about how much?
Roughly about $50 with medication, though, because she's gonna get deworming, some vitamins, and tick-and-free medication.
Okay.
Yeah, but she's a regular client here, a regular patient here, so
You know well.
yeah, so we know her pretty good. She's well behaved.
Okay.
All right, so Michelle is gonna do oral deworming. Go right ahead, Mich.
Oral deworming.
Yes, those are parasites.
That's not that's through the mouth. Yeah.
Correct. Orally by the mouth. Up, Mish. Done? Done? All right, and then keep it.
Then injection.
Yeah, this is just for the heartworm, and it covers worms too in general.
Is
But
there any
heartworm-
special part you have to inject the dog?
it's under the skin, subcutaneous. I usually do the shoulder or the flank,
Okay.
but under the skin, it has to be it. All right, so that's it.
That's it.
That's it. She's done.
And so she's okay to go.
She's okay.
All right. Bella, how you doing? How you doing?
By the way, Bella is an indoor dog, so she sleeps in the house, and the owner they really take good care of her.
So, have the Bella in bed too, or? Huh? She sleeps with you and the wife?
Yes.
Okay. So Bella is really. Come tell me. So Bella sleeps in bed with you and your wife.
Yes, she does. Yeah, that's the reason we try to keep her well maintained.
And you're often here.
Excuse me?
You're often here.
Oh yes, most of the time, like once a month, all the vaccination he did them for her. So she's well prepared and to.
And is Bella always this friendly?
Yeah, she is.
I'm a total stranger, and I am just not touching.
Yeah, she's very easygoing with people. She doesn't like other animals, though. That's the only thing. And like all dogs, I believe.
Want to be the only one, so they're jealous too, no?
Oh yes, yeah, she does communicate well with us. If she's indoor and she wants to go outside, she goes to the door, scratch on the door and bark to get our attention.
Okay.
So
It's a good dog.
I'm going to just finish express the inner gland. This is the scent gland.
What you going to do there now, Doc?
We're going to express the inner gland. This is the scent gland. So because, she's indoor and she lives with them, it's good to just always keep it empty so that it doesn't smell.
Okay.
See?
Okay.
That's the content of the inner gland. So it was full.
Okay. So what does that mean then? Doc, like you're supposed to go to the toilet or?
No. It's just a oil secreting gland that's there. Whenever the dog poop, that helps to like moisten up the poop to come out a bit. But it smells. So whenever you see a dog smell the other dog's butt, it's that they're smelling. They have their own scent.
Okay.
It's like good cologne.
So that's the famous scent that they go smelling, right?
Correct.
That inner gland scent.
Correct.
Okay.
So one more little wipe and we're done.
But when they smell that inner gland, and sometimes they would say, okay, I'm okay with you to the other dog, like they don't do nothing, and then in some instances they do react in a belligerent way. What causes that? What are the smelling part?
Normally, intact males will tend to fight, but male and female they normally will tend to be more friends. Okay. But it's just their distinct smell. Mm-hmm.
So each dog has a distinct smell.
Yes, definitely is. Correct.
Learning a lot about dogs today. The dogs have a distinct smell, and it's that gland that they smell for.
Apart from health check, normal health check like what we did to Bella just now, we do surgeries as well on animal. And then one of the most common surgery would be to avoid overpopulation, which is spay and neuter. And we do a lot of that. At the Warren Creek Vet Clinic, we have a specific surgery time would be in the mornings. So we would ask them to come in at 9 before midday, and then they pick up in the afternoon or the other day. But we do a lot of surgeries on animals, specifically for spay and neuter. But we do other surgeries. Sometimes we do like fracture repair, tumor, removal of tumor, everything else, apart from, just spay and neutering.
All right, Doc, I hear some cats meowing in the background there. These are resident cats, or because I don't see no owner next to them.
These cats were rescued. So one of the guys that was doing maintenance on the highway found them by the bridge, the Warren Creek Bridge. So they brought them in. So we're fostering them right now, and we're going to have them for adoption. We're going to spay and neuter them, deworm, vaccinated, and then we're going to give them out for adoption. Okay. So we got 3 black cats here. You could take one. You could be the first to take one.
So they were found on the roadside, you're saying that?
Yes, sir. They were found on the roadside by the bridge. So we have them here now, and they're up for adoption.
So are there any animals that you have helped to rescue? You told me about some rabbits a while ago.
We usually do a lot of rescue. We help with rescues. I do work with the Belmopan Humane Society. They do a lot of rescue. I work with Cayo Animal Welfare Society, CARS. They do a lot of rescue. And I do work in San Pedro at Saga Humane Society. They do a lot of rescue too. Plus we do clinics in Kikaker, Hopkins, and Punta Gorda with the Punta Gorda Humane Society. So we're very busy. Our hands are full. We go all the way to PG, yes.
So you got a chart something to identify.
For the cats. That's for the cat different breeds. Yeah, most of them we probably don't have in Belize, but it's just, the different breeds of cats.
When we come back, Dr. Baptist shares some helpful tips on taking care of your pets. He also gives us a background of his studies in Cuba. We take a break to hear from our partners.
The B&E Charitable Trust, working in the development of Belize by inspiring young Belizean entrepreneurs to dream and to dream big. The National Gas Company, fueling Belize forward. The National Gas Company makes sure that you not only have a guaranteed supply of gas for every household need, but also that it is of the highest quality always. Shell Belize has been fueling Belize for many, many years, and they have done so reliably and with a lot of dependability. And the Barry stores in Belize City, Belmopan, San Ignacio, Orange Walk, and San Pedro, offering you much more for much less.
We are the Barry, offering you great products, good service, and of course, the lowest prices in the entire country. Visit us in Belize City, Belmopan, San Ignacio Cayo, Orange Walk, and now in San Pedro, La Isla Bonita. The Barry. Get more, pay less.
Shell V-Power, with 3 times more cleaning and friction-reducing molecules. Go well. Go Shell. Since 2008, the Belize Natural Energy Charitable Trust has created opportunities for Belizeans to develop themselves and their communities. The Trust employs tools that are intuitive, collaborative, and accessible so that every Belizean is empowered to achieve their full potential. Over 200,000 Belizeans have been impacted because of our various initiatives. The Belize Natural Energy Charitable Trust, empowering Belizeans of today to create the Belize of tomorrow.
The National Gas Company Belize Limited project became a reality because Belizeans believed in the project and invested in its development, construction, and implementation. Equity financing for the project featured investments from local enterprises as well as one foreign investor. The public-private partnership structure of the project facilitated government's ownership of a 25% stake at no cost to the taxpayers. Debt financing for the project featured the successful launch of Belize's first ever project bonds, some $30 million financed by a cross-section of institutional investors. Investments came from credit unions, notably St. Francis Xavier Credit Union and Holy Redeemer Credit Union, insurance companies, pension funds, and commercial banks. In addition, the project managed to successfully secure some $12 million in debt financing from the IDB Invest. The IDB's participation in this debt financing is a testament to their belief in the environmental, social, and governance principles taken on by the developers of this project. This project is a testament to the growth and development of Belize's financial system. It shows confidence of Belizean investors to put their money behind homegrown and developed projects that contribute to our national development. I am proud of this project, and I'm hopeful that there are many more like it to come.
The National Gas Company of Belize, fueling Belize forward.
It don't matter what part of the jewel they come from.
So, Doc, how often do I have to bring my dog for a checkup?
Normally, whenever you have like a puppy, the first vaccine, we normally do at 5 to 6 weeks. And then every 3 weeks after, a booster, second booster 3 weeks after, and after the second booster 3 weeks after, a third booster and the rabies. So there are 3 vaccines initially. After that, it's every year. We do the checkup that Bella came in to do. It's normally done every year. But sometimes some people come in earlier. She's 6 months, so he just came in for a checkup too. And then we do the round of vaccinations again. But like I said, heartworm prevention normally is recommended every month. Because heartworm does exist here in Belize. It's a worm that grows in the heart.
Yeah, I was going to ask you about the heartworm. What's that all about?
It's transmitted by mosquitoes. So areas like, for example, Belize City, San Pedro that I've worked, anywhere that has swamp, we have a lot of heartworm infestation. The preventative is we have either an injectable or a tablet, and it's every month. It works. And it's pretty cheap. Especially injectable, it's pretty cheap. So that would, really, for example, the heartworm treatment, if you would go to do like a heartworm treatment, you look almost at $1,000. Okay. That could be prevented with 1 shot or a pill every month. Yeah, so it's very important to do that at least.
What are the symptoms that the dog have heartworm?
Symptoms of the dog having heartworm, they normally would have a dry cough. They normally would they get tired easy. If they walk like maybe 2 blocks, they would be panting. But there's always a persistent cough with heartworm.
Okay. Is it reversible?
It is reversible. But it does damage your heart if it gets too chronic. But like I said, we have a treatment which is a bit expensive. But yes, it could be treated. But if it gets chronic, then it definitely affects the heart as well. Okay. So you could call it like heart failure, basically, yeah.
No, a lot of us don't take enough care of our dogs and other animals. Maybe we could talk a bit about the importance of caring for these animals as far as you're concerned.
I must say that I've been in this field for the past 16 years. And I graduated in 2006 from Cuba, Havana, in Universidad Agraria de La Habana. That was my school. So when I came back, I tried to open up a clinic, and it was like really, people at that time, 2006, people weren't that much aware of how to take care of their animals, doing vaccinations and everything else. But now, after 15 years, I could say that they have reached a level that everybody is aware, and they love their animals now. It's a growing trend, and especially with a lot of foreign people we have in Belize, they go the extra mile for their animal. But like I said, Belizeans are being more aware right now. So a lot of our clients are even right here locally in the village, but like I said, we work all around the area, Belmopan, even San Ignacio, yeah. So people definitely care more about their animals, and especially kids. the kids would be the one, Mom, we got to take the dog to the vet. The dog need this, the dog need that. So they definitely do it more than before. For example, before people never used to worry about vaccination. But now, especially with the different breed of dogs, all the toy breed, all the, the pit bulls, everybody, they're more aware. Yeah. And vaccination definitely helps because at the moment, we have distemper that's going around for the past 2-3 years, and the dog, they die. Parvo. We have 2 puppies at the back. I could show you that they're suffering from parvo. So
parvo?
Parvo is a virus. It's a viral infection, and it is characterized by vomiting, diarrhea. So the dog, that's all. They stop eating, they stop drinking. So
these dogs at your back, they're suffering from that?
From parvo. So they come in for fluids, IV fluids. We give them antibiotics. We give them vitamins, appetite stimulant. It takes 5 to 7 days to go through the system, basically. But with the little help, they do make it. We have a good percentage of recovery. Okay. But it's not something that we like to treat because it's very contagious.
Oh, yeah?
Very contagious.
From afar, look at the dogs and see what parvo is all about, because we got to move out of this room into another one to see. This is what you call this, your isolation room?
Yeah, this is the surgery area.
What happens at this table there?
This is where we do all the wonders. Okay. So we would put the dog here, tie them, tie them up and for a normal spay, back, and everything happens. This is the heart temperature respiration monitor. So it's a little gadget that helps us to check the vitals when they're in anesthesia. So this is the first surgery, and then this is the second surgery here. Sometimes we switch from one table to the next.
Okay, so you have 2 surgery rooms.
Yes, and then that is the gas anesthesia machine.
Okay,
so that uses anesthesia and oxygen, yeah. So this is a second surgery area.
Okay.
So these are the puppies that we were talking about, 2 puppies that came in, and if you could see, they already vomited already, and this is like been the 5th time we already clean. Normally we don't keep them in clinic because it's contagious, but we just keep it for the day. But like I said, they're under medication already. They already got their meds. If you could see, they would look very sad.
Yeah.
So if a unvaccinated puppy come and lick either the poop or the vomit or contact with them, the virus spreads like that by contact.
Okay.
And especially with the rain, it could stay in the environment for up to 6 months. So if a dog poops outside and it rains and it washes down and the other dog goes and maybe drink the water or so, they could get infected. Okay. So it's a deadly virus.
A deadly virus indeed. Can it affect human beings?
No, negative. That's the good thing. It doesn't affect humans. But yes, dogs principally. It doesn't affect cats either.
So sometimes you look at a little puppy like that and you see slim or maga, for want of a better, but nice Creole word, maga. You see maga, slim like that. Yeah, it's because of the virus. The virus is because of the virus, right?
Correct. Because they're not eating, they're not drinking, so they lose weight, they lose body mass, So yeah, but you could see from afar that something is wrong. And then, like I said, 70% of the information we get from the owner. So the owner will come in, my dog's not eating, they're not vaccinated, they're vomiting, they're pooping blood. They usually poop blood with parvo. So that's a telltale sign.
No, these are on the way to recovery, like you're saying, from parvo. What happens next after you decide, okay, I've cured the parvo, what do you do next with the dog?
We recommend that once they recover, they start eating. That's mean that they're recovering, they start to eat, which takes, like I said, 5 to 7 days. Then we give them 1 week and we vaccinate them over because the vaccination is a 6-in-1 and it covers other disease apart from parvo, lepto, distemper. It covers, and even coronavirus as well.
Oh yeah, you mean dog can catch coronavirus? Yeah,
there are different type of coronaviruses, so it does affect dogs too.
Not the COVID that we thought we human beings.
No, that different strain, but it's a coronavirus as well. Okay. Yeah. So it's very interesting. Animals do get sick the same way human does. Animals do get sick the same way.
So the message here would be take care of your animals. If you have an animal, take care of your animal.
And get them vaccinated, the full course of vaccination.
So just like how vaccinations work with us, vaccinations would work with animals as well. Animals do need to get vaccinated as well.
That's correct. That's correct. Definitely. So that's the importance of vaccination. If they would have been fully vaccinated, they probably wouldn't have get this infection.
Okay. So at what age should you vaccinate your puppy? Your
Normally at 5 to 6 weeks. Once they're weaned from their mom, usually at 5, 6 weeks, then we vaccinate them. And then, like I said earlier, that the schedule call for three series of shots. Every 3 weeks, we vaccinate the second and then the third, and then the rabies with the third vaccine normally.
So keeping a dog as a pet is a full-time job or almost?
It's a full-time job, but it's worth it because animals do express their love to their owner as well. And like Mr. Paul mentioned earlier, the dog is their pet and like their kids. Sleeps with them. So they got to keep them healthy, right? Yeah, so that's very heartwarming to hear people say that, they love their animals so much. Yes.
So your assistant has in her arms one of the rescued kittens, right?
Yes, we got 3 of them that were rescued by the bridge. So, they don't have owner, they're young, so we're keeping them and they're up for adoption. If anybody wants one, you're free to have them. We're going to try and spay or neuter them. We haven't even checked the sexes. Is that a male or female, Michelle? Can you check for me, please? And they're all black.
3 black cats, right?
3 black cats.
I'm sure those black cats after the show will go very fast.
Definitely. Male?
It's a male cat, a male baby cat.
Yes, it's a boy.
It's a boy.
All right, so
about spaying and neutering, Doc, tell me a bit more about how that works.
Advantages. Spaying and neutering, okay, what that entails is that we call spay for the female, which means that we take out the reproductive organs, which is the ovaries and the uterus. So the dog or cat, they don't go in heat, they don't roam after that. They don't bleed, like go through that menstrual cycle that dogs usually do. So in a way, they're more healthier, they're cleaner. The risk of having like tumors, mammary tumors and other tumors is reduced by 80%. So it's very important.
Your assistant say you have to hold a cat.
And then in cases of the male, it does reduce tumors, like testicular tumor as well. The animal, they don't go in, females go in heat and the males smell them and that's when they go wild. They would go for a week without eat or they would run, jump the fence. And it helps with male with the aggression. It lowers the aggression level. So it definitely have a lot of more advantages and disadvantages. And they live longer. They live a happy, longer life because they don't go on the street, they don't get knocked, they don't get in fight with other dogs. So it definitely helps a lot.
So when you neuter a dog, you're in fact killing his sexual desire, right? Basically, that's what you're doing.
Yes, definitely. Yes, that's we could use that term definitely.
And so, but you also said that the cat would go or the dog would go a month or a week or so without eat when the female is in heat. So
They would run away and want to eat.
that means you have one track mind and during that period.
Yeah, they could smell a female from a mile away.
Oh, yeah?
Yes, when they're in heat.
Wow. A mile away.
Mile away. Correct.
That's a great sense of smell.
Then if it's not a full breed animal, then we don't want them to reproduce. So let's say, for example, the local lag patlika. You know what patlika bite as well, you just tie off. Are you healthy, you live healthy, and you mind the yard better?
And you're happy, huh?
Definitely.
Well, Doc, earlier I heard you mention that you studied in Cuba, right? What years were you in Cuba?
Yes, I studied in Cuba, and I was there from the year 2000 to 2006. So I did 6 years in Cuba.
So it takes 6 years to to qualify as a vet studying in Cuba? 6 years?
That's correct. 6 years of studies. Everything was done in Spanish, so you had to have the Spanish background as well. We did a prep course, a crash course, about 6 months in Spanish, so that helped a bit.
Well, let me get to know your life, Doc. You were born here in Roaring Creek, or tell me about your early life.
Yes, I was born here in Roaring Creek, born and grown in Roaring Creek. I studied in Belmopan Comprehensive School. Well, we were in quick primary, Belmopan Comprehensive. I did Belize College of Agriculture. And from a young age, I had the passion of working with animals. My dad was a farmer, so we always had animals, horses, pigs, chickens, dogs. So we used to deal with them. For example, at a young age, we were castrating our pigs, tending to our horses, and then we had cattle at one time. So it was a passion for me, so I did the Belize College of Agriculture. From thereafter, I did shrimp farming for a couple of years in the south, and that was when I decided that I need to study some more or, get into. The shrimp farming wasn't working out for me.
Okay,
I applied for a scholarship through the Ministry of Education and Cuba government. They were giving us scholarships. So initially, I sent in my application. I forgot about it. 6 months after, or 3 months, not 6 months, maybe 3 months after, I got a call that I got accepted for the scholarship, but I need to go like the next day or by the next week to be in Cuba. I was like, no, it's not gonna happen. We had a hurricane that passed through Belize at the same time. I don't remember the name, but it was 2000. So my brother used to work with the Ministry of Foreign Affairs, so he facilitated me on whatever I needed to get and everything. So quick, I said, okay, I'm going. I'm fed up with the shrimp farming. I had to do I had to travel all the way to Cancun alone by bus, Cancun to Cuba. Now in Cuba, I never really know much about the scholarship because it happened so fast.
What was your first impression when you arrived in Cuba? What was that like?
It was like, so I never, it was very strange because the language is different. From the plane, I could see the terrain.
You knew a bit of Spanish, right? Obviously.
I knew Spanish from high school and just talking, but I wasn't very fluent. But like I said, we did a Spanish course. But yet, yes, arriving in Cuba, everything was different. I saw the old cars. Like it was a really shocking mental shock for me in the beginning. And then when I arrived at the university, I was thinking, am I at the correct place? It looked like a prison. But after that, I met some friends. Belizean friends were there, Caribbean friends. We did a prep course, so we had a lot of friends from the Caribbean there. So it all, helped because it's shocking that I was feeling like coming back home like the next day. But after meeting friends and new people, it helped a lot. Yeah.
At that time, I can remember, I think there was a stipend being given by the Belize government to students in Cuba to assist them in covering some of their expenses while they're, were you a recipient of the stipend?
Correct, yeah. We used to receive $100 US per month. And the Cuban used to give us foreign students a stipend, but it's very minimal, but in terms it was something. And then I used to teach English at the university. So I had an extra little, not much, but they paid me to do to teach English to my classmates. So after like I could say the first 3 years were really tough because it's a lot of theory, the language and everything, and the exams were a bit hard. All our exams were orally. We had to sit down in front of 3 doctors and tell them about information. They wrote the book, so you gotta be. Imagine you writing a book and I come to tell you what you said in your book.
Yeah, you have to read the book properly.
Correct, and they were like, I didn't say that. Yeah, but after the 3rd year, like everybody becomes family. It becomes routine. Although vet school was tough, we had a lot of friends that help us pull us through. And then by the end of the 5-6 years, then it's like you don't want to go home again. You would stay the next couple of years.
So you wanted to stay in Cuba?
I could say that. That yes, we got used to everything there, and what helped us was that.
What do you like most? What got you used to everything there, like you said?
We had a lot of friends. Friendship, and then just being in a different country, living there and making it, and we help each other. For example, in Cuba, you're not supposed to have a business, but after like 4th year, we we had printers, so we were printing work for different people, and we would charge them a little fee. So, but at the end of the day, you're helping one another. And sometimes I took time out of my own busy schedule, and I would like, your work is not correct. We need to fix this. We need to fix that. And, we help each other. We had a lot of friends, Cuban friends, Caribbean friends, all parts of the world. In my university, we had like about 55 different nationalities. Wow. So we had Central America, we had Africa, we had Asia, we had everywhere. Yeah. Ethiopia, we had Vietnamese, everywhere. So you make a lot of friends. Uh-huh.
So you said you wanted to stay in Cuba, but why didn't you stay? What made you come back home? Was it the call from home, that inner piece of us that makes us so proud to be Belizeans?
Definitely, the call from home. But yeah, after 6 years living, you fall in love with the place. You want to hang with the people that you're comfortable with, and it's a nice experience. In the beginning, it was tough, but like I said, after the years, you grew with the system.
But you came back home, and so what was it like coming back home?
Yeah, coming back home, well, I could say it was good. In the beginning, it was bad because, like I said earlier, that people wasn't embracing veterinary medicine, taking care of their animals. At first, I started teaching at the Belmopan Comprehensive High School. I taught there for a year. I worked a year with the government doing other stuff that are not veterinary related. Then I decided that, no, I want to study this. I need to do something in it. I opened up a clinic. It was slow at the get-go, but eventually things started to work out. We started to do volunteering work. Then I started working with Belmopan Humane Society. We did some free clinics. I started to work with an international group. We go different parts of the world to do veterinary work, free veterinary work. I work with a group that by the name of Helping Paths Across Border. We've been in Puerto Rico, we've been in Honduras, Guatemala, we've been in Belize. We were supposed to go to Brazil and Africa, but it didn't come true because of Corona and other, stuff. But yeah, definitely, I have made a lot of friends, both nationally and internationally. And to me, it's an honor when people, when people, for example, in Puerto Rico, I was one of the surgeons there, and they actually brought food and gift for me after I done surgery on the animal. And this was like, it's a nice experience. On Facebook, they send you a friend request, and when then they start telling you, oh, thank you so much for everything. Yeah, but apart from that, we do work with Cayo Animal Welfare Society. They're basically humane society. We do Kikaka Humane Society. We do Saga in San Pedro. I work there like 2 days a week. Every week we go there 2 days. And Hopkins as well. And we're starting PG as well.
So you're moving around?
The whole country we do, basically. Mm-hmm.
Moving around, Doc, a lot. And business has been good here at Northern Creek?
That's the only thing, because, I can't be here every time. And I'm like, I need to stay home more. Because then when I'm not here, then everybody looking, they want some service. I'm not there, sorry, but, I can only do so much. So helping other areas, then I neglect my own community, but we're trying to level everything.
But you have two assistants here, Doc, I guess, but they can't do the delicate surgery, I guess.
Correct. Yeah, they could do like checkups, deworming, and minor stuff, but whenever it comes to surgical stuff, then I would have to come in and do it. Okay. Yeah, and then the client, they want to see my face. Yeah. So it's tough. We get busy though.
I could imagine.
We will wrap up our discussion with Dr. Baptiste and his team after we take a break to hear from our partners, Shell Belize, the Barry, the National Gas Company, and Belize Natural Energy Charitable Trust.
We are the Barry, offering you great products, good service, and of course, the lowest prices in the entire country. Visit us in Belize City, Belmopan, Sa Ignacio Cayo, Honduras, and now in San Pedro, La Isla Bonita. The Barry. Get more? Feel less.
Shell V-Power with 3 times more cleaning and friction-reducing molecules. Go well. Go Shell. Since 2008, the Belize Natural Energy Charitable Trust has created opportunities for Belizeans to develop themselves and their communities. The trust employs tools that are intuitive, collaborative, and accessible so that every Belizean is empowered to achieve their full potential. Over 200,000 Belizeans have been impacted because of our various initiatives. The Belize Natural Energy Charitable Trust, empowering Belizeans of today to create the Belize of tomorrow.
The National Gas Company Belize Limited project became a reality because Belizeans believed in the project and invested in its development, construction, and implementation. Equity financing for the project featured investments from local enterprises as well as one foreign investor. The public-private partnership structure of the project facilitated government's ownership of a 25% stake at no cost to the taxpayers. Debt financing for the project featured the successful launch of Belize's first ever project bonds, some $30 million financed by a cross-section of institutional investors. Investments came from credit unions, notably St. Francis Xavier Credit Union and Holy Redeemer Credit Union, insurance companies, pension funds, and commercial banks. In addition, the project managed to successfully secure some $12 million in debt financing from the IDB Invest. The IDB's participation in this debt financing is a testament to their belief in the environmental, social, and governance principles taken on by the developers of this project. This project is a testament to the growth and development of Belize's financial system. It shows confidence of Belizean investors to put their money behind homegrown and developed projects that contribute to our national development. I am proud of this project, and I'm hopeful that there are many more like it to come.
The National Gas Company of Belize, fueling Belize forward.
It don't matter what part of the jewel they come from.
Well, Doc, you know, it's important to have good assistants, right? You were saying that you cannot be here all the time, so I suspect that a lot of times Michelle is the person here attending to folks, who people would see. And you said, Michelle, well, what are Michelle's capabilities? You mentioned it a while ago. Mention it again to me. Let us see what Michelle could do.
Michelle is a veterinary assistant. She did her studies at Galen University, and she did her internship here, and now she's working here with us. And she's very capable, and like I said, she's learning, and she's aspiring to be a veterinarian as well. So we're pushing her, and you know, it could happen. You just gotta keep your head up and be ready to grasp whatever opportunity whenever it comes. So I would like her to just see her experiences and tell us about maybe how the course at Galen works, and if what have she learned here.
Yes, those are very good questions, Zach. And let's find out from her. Let's find out from her what all she. But first of all, Michelle, you were born here in Roaring Creek. Where are you from?
I'm originally from Unitedville Village.
Okay. And how old were you when you realized that, hey, I like to deal with this type of work, veterinary sciences?
I always been around animals because my family, we into sheep and animals. So in natural, it come to me my family read about animals, so they never want decision I need to make. That me need to put myself to it and say, this is what I know, this is what I used to, this I like this. So I decided to push myself into it because that's what I know and I enjoy it.
What were some of the early things you did even before going to Galen, so where animals are concerned?
The first thing I could remember about me wanting to become a veterinary surgeon or technician, it would be, this might be gross, but me and my pa used to have like dogs, and we keep them outside, so like flies would bite them and beeform would go in at their skin. So like that, the first memory doing veterinary stuff coming to for me. I used to help my pa take it out and take out the beeform, and then I also used to help him administer like different vitamins and things for sheep and things. So I may used to all this, and now I come with Dr. Baptist and I Ghana Galen, so I have more knowledge on it.
Before you tell me about your Galen experience, tell me about your parents. You said you grew up with your parents, and tell me about the parents so we can establish who they are. You might even want to tell them hello.
My parents, the Michael and Donna Betran, and we mostly base, like, we do sheep things, and well, we mostly have sheep, so sheep farming, so that where one of my love for animals come into, and we have dogs and other animals, so it's natural for me to get into this kind of thing.
Now tell me the experience at Galen, how you got in touch with Galen, and what was the experience like and what you learned.
Initially, I wasn't even thinking about Galen, and I was trying to become a nurse, but then that didn't work out for me, so my mom told me to apply at Galen because she knew that I was into animals, so I decided to apply at Galen, and I got accepted, and right away I knew that this is what I was supposed to do.
Tell us what you learned on the course and what course you took.
The courses are, first we did like a zoology class and anatomy, and I don't remember the rest. Yes, we did a lot of practicals, and also we needed English. We did a whole English class because we need to write, like, if a client come in, then we would need to take the information. In English, yeah. So we needed an English class for that. But all the rest of the classes were based on animals.
And you think that's the base, that was the base that from which you should come to see the good doctor over here for a job. How did you get in touch with him?
When I finished Galen, it was kind of like a rough part for me because I didn't have no connection with no other vet, and I didn't have no connection with vets, so I was just doing pet sitting. Then I met a woman named Miss Eden, and she got me connected with Dr. Baptist, and that's how I'm here now.
Okay. So how long have you been with Dr. Baptist again? Remind me.
About 6 months or more.
And what all have you learned here at Dr. Baptist in the last 6 months?
I have to say the theory is, you need that, but the practicals, yes, that what stick to you the most, more than the theory sometimes. And Dr. Baptist definitely give me a lot of knowledge, and he helped me and pushed me, and I appreciate that because he teach me everything what I need to know.
Now, what is in the future for you? What are your future plans moving as you get older? For right now, I guess I want to continue working with Dr. Baptist, and then
I plan to become a surgeon, so I want to go out to the country.
Animal surgeon?
Yes, we are a veterinary surgeon. So I want to go out of the country to study and then come back.
Okay. So that's your ambition. Now, you're a very young person. Maybe you could talk to young people like yourself as to how important it is to have. Obviously, you had a dream in you, and you pursued your dream. I mean, even wanting to be a nurse is associated with, could be associated with what you're doing, really. How would you talk to young people like yourself as to the importance of them having a dream or having a goal in life and following that goal and setting a purpose for themselves?
I would say to the younger, well, my age too, even if you think that, oh, I know they make grades good, I know they do all of that, like you still could, like it's never too late to make you be somebody, what call it? Like it's never too late to make you follow your dreams, it's never too late, and never think that, oh, because my circumstance, I can't do nothing, because they always gone away, but you just have to walk in at that step and keep your head in that direction if that's what you want to do. And it always won't work out at the end, but you have to put in the work.
So I guess we'll soon be seeing another lady surgeon vet in Belize in the next few years, right?
Yes, sir.
Well, I want to wish you all the best, and I want to thank you so much for talking to me. And Dr. Baptist, I'm sure, is very, very proud of you because he seems to talk very highly of you.
Yeah, definitely. And like I told her that an opportunity gonna come. We're looking for it because there's scholarships out there. Just that you need to grasp it at the correct time, no? And she's pretty young, so her time is coming, definitely. And then she's in the correct direction, working and doing what she loves. So time is gonna tell more, and in the near future, we're gonna hear from her, definitely.
Well, Michelle, again, let me wish you the best, and I'm sure you are going to achieve your dreams. Never, ever give up in life. Success, I used to have a sign in my office, and it's a saying I always carry with me, that success consists of getting up one more time than you fall. So don't let anything keep you down. Keep moving towards your goal and towards your dream, and you will be very successful one day. Well, Doc, we have been joined by another of your employees, the second of your employees, right? Romelio Lemus, right? And so, Romelio, thanks for agreeing to talk to us. And let's get to know you, Romelio. Where were you born and how did you grow up?
Well, I was born in Kettle Village, and then I moved into Belmopan. No? Then that's where I met Dr. Orlando Baptist. I was out of the country, and I got a phone call, and he's like, Romelio, when you get back, you should come and work for me. That was late 2019. From ever since, I've been here. So everything I learned, it was hands-on. He did teach me well. I am his assistant for a while now, so I do vaccination. We do surgery prep, and I do basically, what he can handle on himself. So I will be doing outside.
So when he's not here, you are the man.
Well, I do I do the vaccination of the puppies, and mostly now I travel. We do PG and Hopkins and Kikaker, San Pedro, and what he like most is my driving, I believe.
Okay, so you drive him around?
I drive him around, yes. But we do have a good clinic here. Dr. Baptist is like one of the best. Actually, I believe he is the best surgeon in the country, and we do good, excellent job in. People like it, people do like it.
No, tell me, how did you become interested in this type of work? What sparked that interest? And how old were you when you realized, hey, I'm interested in vet science?
Well, I wasn't until I wasn't, yeah.
Until you met Dr. Baptist?
Until I met this guy, yes.
But you applied yourself quickly. Well,
Yeah, it was a change because I didn't like much animals. But since I started working, I did learn to appreciate and, and care for animals, yeah.
so Doc must have spotted something in you that you didn't know you have.
He must have sparked something, yeah.
What was that? Doc, what did you spot in this one that he didn't know he have?
The guy is very trustworthy, and if I tell him we're going to go to this farm at 8 o'clock, he'll be here from 7:30, and that's something that you like, and it's a very able assistant as well. If we need something done, we get it done. Sometimes we need a helping hand. We can't do it alone. If we're working in a special large animal, you need 1 or 2 or 3 assistants, and he's very good at, helping, assisting, and he learns very quick. So it's very, very good worker.
And so for your future now, what are your plans? Staying here with Dr. Baptist?
For now, I'm basically a temporary worker. I do have my own business, what I do.
You got your own business? What kind of business you do?
It's called Lemos Upholstery Cleaning. So we go to your home and we clean your sofas, we do your rugs and mattress.
Okay, so you do your own, you're an entrepreneur on your own.
Yes.
And you assist Dr. Baptist otherwise because you like this, right? Now tell me about Lemos
Upholstery Cleaning.
Upholstery Cleaning. Tell me, see, you got the opportunity to do a free commercial here. Tell me about Lemos Upholstery Cleaning.
Well, Lemos Upholstery Cleaning.
How you started? You started it, or?
Yes, I started it a while ago, and it have come along so far, so good. And we go to your home, and you don't have to, everything. While we're doing your cleaning, you could be watching your TV. Because we do in interior of your vehicles as well. Yeah, so everything we're mobile.
Where are you located? And then you also mentioned the word we. So where are we located, and who are we?
Well, Lemos Upholstery is connected. It works along with in partnership with another guy in Belmopan. He's Agustin. And so we're located in Raccoon Street in Belmopan. But mostly what we do there is the rugs. We go to your home and we pick your area rugs and we clean it there. But apart from that, your sofas and the mattress, everything gets done at your home.
But you are not there. You are here at the clinic. So obviously you like the clinic a whole lot. And then you drive the doctor all over the place.
Yes. Well, we have workers. So then...
Oh, the workers are taking...
Yeah, the workers take care of, and I loved cleaning myself. So, but when a doctor called me over, then I come to here, and then I have the guys working.
Okay.
Yes.
Very good. So you're an entrepreneur all by yourself, all on your own.
Yes. Yes.
Well, congratulations. I like to see young people. Well, how old are you, if I may ask?
I'm 35.
And what would you say to other young people, more or less your age, when it comes to being an entrepreneur, trying for themselves and moving forward?
Well, there is nothing much better feeling than working for your own self, working on your own time and not depending on someone to give you your daily bread, So, but pushing yourself to become someone independent, and that should be the best aim for all young kids out there.
Very good. So, Doc, you have a good choice of helpers, man. So you have an entrepreneur here who will maybe put an entrepreneurial spin on your clinic one day.
Definitely. Like I said, we work with a lot of young people, and this is my crew here, my trusted crew. But in other places, for example, Hopkins, we have a crew. San Pedro, we have a different crew at the different clinics. But this is personal, my area, my crew. But and they're very good assistants. Excellent.
Yeah, they're good assistants indeed. So this is a work of love. You love, I can gather by talking to each of you that you love what you're doing, and you're doing this because you love doing it. Most definitely, right? I agree. So when you talk about love, we have choices and we choose to love. And I know, especially you, Ramel, you want to help me say Belize and beyond. Thanks for choosing love, right? Let's see how you'll say it.
Love FM, news and music power.
Okay, you see, and you don't say that now, you see? But I could say it for you. Yes. Love FM, news and music power. Right. Anyway, let us just say together, Belize and beyond. Thanks for choosing love. Belize Watch. Knowledge of the past, impacting the present, building the future.
Celebration time. It don't matter what part of the jewel they come from. You that you.